Etiology of male infertility. There are three main categories responsible for the production of infertility, that is, the decrease in the number or absentee of the sperm cells in the semen of the man. That is divided into pre-testicular causes, testicular reasons, and the post-testicular etiology factors. The main etiological factor is autoimmunity, that is, the production of antibodies by the immune system of the person against the sperm cells. Though they are normal ones, they are innocent ones, but mistakenly our immune system in the infertile patient that attack the normal sperms and destroy them. The process is unknown. It is that is the gene defective gene in the immune system, due to which they can't judge identify the normal tissues or the factors of the body. So due to which there is decrease in the number of sperm cells in the semen. If the sperm cell is decreased below the normal count, they are termed as oligospermia. When it is absolutely absent in the semen or mostly dead or not motile one, active one, that is termed as azoospermia. Next is the genetic factor. Due to mutation of the genes, there is production of double XY chromosome, which is 47th extra one chromosome in those persons who are suffering from genetic infertility. There is familial predisposition. Most of the families bear this fact that mostly they have no offspring in their families due to the infertility in the men. So it is due to the mutation of the genes, abnormal genes, and extra chromosome formation in those persons who are suffering from genetic infertility. Then next are the environmental causes, which are due to the radiations, chemicals, pesticides, especially factory manufacturing, mercury and lead particles, and X-rays radiation, person working in the X-ray plants, and similar, laboratories where X-rays or the high voltage X-rays are used. These all factors, they damage the capacity of the testicle cell to produce sperms. In other words, they reduces the process of spermatogenesis. Next is varicocele. In this pathology or disease, the veins of the testicles and all the in the scrotal cavity, they become blocked, tortuous. The blood drainage of the vein is impeded, obstructed, due to which there is pooling of the blood or the accumulation of the blood in the testes. Hence, due to this process, the temperature of the testes is increased. So another factor is raised temperature or warmth to the testes also decrease the production of sperms. That is, they reduces the normal spermatogenesis process. Due to this, there is obstruction in the outflow of the veins. So due to this pressure as well as high temperature, both these factors, they impede or reduce or decline the process of the spermatogenesis, due to which the sperm count is decreased in the semen. Mostly excess use of alcohol, tobacco smoking, non-prescription drugs, and the anabolic steroids, they also are the risk factors or the responsible factors for the reduction in the sperm production. The other systemic diseases, that is diabetes, that produces peripheral neuropathies and that affect the process of hormones production in the related organs and the glands, hypertension, obesity, these are the factors. Mumps, there is mumps architis, epididymitis. Another factor which is the mechanical one, that is if the production is normal but the outflow of the sperms from the testicles via epididymis onwards up to the end, that is penile urethra for ejaculation, there in this pathway, in this route, any obstruction due to trauma, radiation, surgical injuries, or the inflammatory process, cyst formation, papilloma formation, polyp formation, hypertrophy of the epithelium, inner side of the ducts, that is vas deferens, ejaculatory duct, there is, there is prostatitis, seminal vesicle is inflamed. All these factors, they produces obstruction and outflow is reduced. The end result is the timing of the sperm is increased, but they can't survive after a long time. Obstruction. They have to reach into the fallopian tube immediately after ejaculation. So if there is obstruction, these living sperms, they are dead and become immotile.